going to take this down too. So I'd like to thank everybody for coming out, and what I'm going to do is speak very briefly comparing H.R. 3200, which is currently the bill that's in Congress, with the single-payer legislation, H.R. 676. Now, right now, there are probably about 10 bills that are floating around in Washington, D.C. The big three, really, are going to be H.R. 3200, the one that's in the House, H.R. 676, which is going to be substituted and will be substituted for 3200. And then on the Senate side, the Senate Help Bill, which is the one that's currently written. There has been no bill drafted yet from the Senate Finance Committee. If anyone wants to see H.R. 3200 or H.R. 676, I have both bills in the House present with me. All right? H.R. 3200, if I was going to bring it up, I'd need two strong people to go and carry the 3-inch binders that hold those 1,000 pages. H.R. 676 is 29 pages long. There's a lot of sins you can hide in 1,000 pages of legislation. All right, so let's get down to it and let's talk about it. There are some good things that are in H.R. 3200. Number one good thing, they define a minimum standard for what health insurance must be and what it must cover. Number one, they basically say that it's got to cover medically necessary procedures. They also say covered by all qualifying health plans will now be maternity care and well baby care. I always considered it ridiculous that you could purchase a health insurance plan and have young children and babies and have them not covered for well baby care. So that's in there. Mental health is now again supposed to be on parity with physical health. So they have made some leeway in terms of what's going to happen with insurance. Also in the bill it says that pre-existing conditions can no longer be used as a reason for denying coverage. So, all right, they pulled off the pre-existing conditions. So basically they're saying the insurance companies are going to have to cover everybody. Okay, that's the really good part. Now, the insurance companies are spending $1.4 million a day, and they're very generously spreading it around Washington. When you spend that much money, you definitely get a lot of things in legislation for your money. All right, yeah, $1.4 million a day. So they basically came into Washington, and for all intents and purposes, they bought Congress. Number one, what did they get? Health care is no longer a right. In H.R. 3200, health care is now a responsibility. And with that responsibility comes a mandate or a law that says you must buy health insurance. There is no law that says you have to have a house to eat, to live in. There is no law that says you have to have food to eat. But H.R. 3200 says you will and you must buy health insurance. And if you don't, the enforcement arm is the Internal Revenue Service. The IRS will levy a fine against you if you do not buy their health insurance. I don't believe this is the health reform that most Americans signed on to when we chose our current president. All right, I don't believe that's what we thought we were signing up for. We were told, don't vote for Hillary Clinton because she wants to make health insurance mandatory. Well, now we've got mandates. We were also told, don't vote for John McCain. Well, there are a lot of reasons for that. But we were told, don't vote for John McCain because he wants to look at taxing health care benefits. Why do you think they made the IRS enforcement? They are getting ready to tax us, especially on the employer side. So every insurance company will be reporting to the IRS every human being that they cover. Now, as I said, $1.4 million gets you a lot of beef. Now, they did also demand that the insurance companies lower their premiums. I know some people, okay, they got some premiums lowered. I know some people that are currently paying 24% of their income for health insurance. There probably might be a few people in this room paying a little bit more. Now, the health insurance premiums are going to max out at 12%. But again, remember, we have 50 million people or about that currently don't have any health insurance, and now by law, they're going to have to go out and they're going to have to buy some. So they are putting the ceiling on that at 12%. Now, here's the other kicker. Dr. Newby was saying your premium should basically be able to reflect your healthy lifestyle, not in 3,200. In 3,200, the premium ticker is going to be based on age. So if you are an older American, and they have not defined what older American means, but if you happen to fall into that category, you could be paying up to 2 times what a younger person would be paying. So now the differential is solely based on age, not performance, not healthy lifestyles, but it's 100% based on age. As I said, a lot of money buys a lot of consideration. So that's really what we're looking at on side 3,200. Now, administrative costs and the way that this is going to be structured. Since 3,200 is really based on private for-profit health insurance, and we already know that private for-profit health insurance roughly carries about a 30% administrative overhead, meaning there's about 30% of the money that they get from our premiums that does not go anywhere near providing health care. When we look at and talk about the whole concept of the public option is only going to be available through the health insurance exchange, which is an administrative overhead that does not currently exist for the United States. They invented it in Massachusetts, and it basically brought on an extra 4 to 5% in administrative overhead. So if we take our administrative overhead and put it at 30%, we will now be at 34% for administering the health insurance exchange. And let's assume the insurance company is not willing to report every human being they cover to the IRS for free. Let's assume that they want a little money back. That will probably add, I'm going to just be generous and say they're only going to want 1%. They're going to do that for 1%. That would have us at 35% overhead. And this is something that we're going to have to pay for. One of the sheets that I distributed was, we actually now have the numbers so that we can calculate what the health insurance premiums would be in the health insurance exchange. Now, they didn't make it easy. They gave you the federal poverty level, and they said if people are in the federal poverty level, then they're going to be paying this much insurance. Well, luckily, Rick is a former CPA. He's a former Internal Revenue Service agent, and he studied to be an attorney. So we were able to sit down and calculate what all these numbers would be. So this sheet that everyone has, we started with the Center for Policy Analysis, checked their figures, and then we calculated what you would be paying if we were looking at HR 676, which is basically 3.3%. Oh, now let me add one more thing. The HR 3200 health plan, the basic health plan, does not include dental for adults, nor does it include vision for adults, but it does include it for children. It also carries co-pays. An individual could have a maximum out-of-pocket outlay in a year of $5,000. A family could have a maximum out-of-pocket outlay of up to $10,000. All right, and remember, this is topping out at about 12%. Okay, now to the sheet. I suppose it's the back of the sheet, there is a table. We're going to be subsidizing people who are single, making up to $43,000 a year on HR 3200.